second neurotransmitter that I like to talk about and I think is really important for understanding addiction would be glutamate. So glutamate is the most abundant neurotransmitter in the human brain, and glutamate is responsible for memory, laying down memory. And I call it the executive assistant to dopamine, because when dopamine is released and we have a pleasurable experience, glutamate comes along and it kind of documents that. And it says, oh yeah, this was enjoyable, right? And it keeps a file of what event was enjoyable when dopamine was released. But glutamate is a really well-educated executive assistant and is able to keep track of events surrounding dopamine release. So the first time someone uses oxycodone, dopamine's released and glutamate goes, oxycodone is awesome. And then the next time glutamate goes, well, that oxycodone came in an orange bottle. Orange bottles are awesome. Pharmacies are awesome. The house on First and Third is awesome, right? All of the things that get associated with the use and the flow of that dopamine get documented and filed away as a pleasurable or like a pleasurable adjunct. And so glutamate is responsible for all of the places, people, things that are associated with drug use. So moving on, I want to talk about trauma. And the reason I want to talk about trauma, and it feels like an abrupt shift, but it's not, I promise. Trauma is actually very similar in structure in the brain to drug addiction. And by that, I mean, when someone experiences severe trauma, we release a hormone called corticotropin releasing factor, CRF, right? When we release high levels of CRF, for some individuals, what happens is our brains start pulling away dopamine receptors, which is the exact same thing that happens with addiction. So, trauma, high levels of CRF, dopamine receptors get taken away. When the dopamine receptors get taken away, what that means is the threshold for pleasure moves up, which is the same exact thing that happens with addiction. Now, let's consider the fact that many people, if not all, who have addiction also have trauma. So you experience trauma as a child, as an adult, doesn't matter. You have trauma, high levels of CRF, low levels of dopamine receptors. You're going through life kind of dysthymic, nothing's really enjoyable, and then someone hands you a joint, a beer, some kind of drug, and you use it. And that's enough dopamine to get past that threshold. And you go, oh my God, that's it. That's what I've been looking for. I feel normal. And so that person continues to seek out that feeling of normalcy through the use of chemicals over and over and over. Well, now they're using drugs all the time and spending all their money on drugs and trying to get drugs and lying to people to get drugs and doing all of these things, which become in and of themselves very traumatic experiences. And so that trauma becomes chronic and severe, which then contributes to the brain getting worse. And it becomes this vicious cycle, right? On the flip side, somebody who just starts with addiction, let's say they go to college, no trauma, they just start drinking and using, they have a gene for addiction, the gene gets triggered, they're using more than their friends, their life gets exponentially worse from their drug use, and now they're starting to experience those traumas of seeking out their substance, or they dropped out of college and they're living with their parents and going to the bar every night and they can't hold a job, and so that all becomes chronically and severely stressful. So trauma and addiction really mirror one another, and they also contribute to one another. And so it becomes this vicious cycle of one contributing to the next, right? So trauma and addiction, very similar. So when you have high levels of chronic and severe stress, the brain looks just like addiction. So what happens in addiction, and again with trauma, is pleasure deafness, right? The inability to experience pleasure like normal people do, or like you previously did before the change in the brain occurred, right? So pleasure deafness or anhedonia is what is occurring. So addiction is a stress-induced pleasure deafness, right?